This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. You know, while most people who contract COVID-19 recover in just a few weeks, about 10% continue to have symptoms that linger for much longer. They're called long haulers. Here to share her story, we welcome Annette Gillespie, along with Providence Heart Institute cardiologist Ty Gluckman. Good to have you both with us. And let me ask you first, Annette, do you know how you got COVID and how sick were you?
I can't hear anything.
Oh, Annette, you can't hear me? Can you hear me now? No. Okay, while we have Annette there, then they work on the audio for that. Let me, can you hear me now, Annette? I heard you.
Yes.
Okay, so do you know how you got COVID and how sick were you?
So I am a floor nurse at a local hospital, and I got COVID taking care of a patient that we knew was ill, but I forgot a piece of my PPE while caring for her. So I got sick back on April 28th of last year.
Wow. How sick did you get, and did you ever get hospitalized for it?
I got really sick. I had all of the typical symptoms, kind of go through and check all of those boxes. I had fevers for 12 days. I had intense gastrointestinal symptoms, the cough, shortness of breath. I was so incredibly weak that just holding my phone was too much. I would just lay there with my eyes closed because even my eyelids were too heavy.
Oh my gosh.
I never was hospitalized, but I did go to the emergency room for treatment at one point.
And you're a single mom. Like, how do you handle that?
It was really difficult being a single mom, trying to take care of the kids. I had family members who would come and drop off food for them every night, and they would just throw water at me to try to keep me hydrated.
Wow. So you're a year out, about nearly a year out. What kind of symptoms are you experiencing now?
I still have a list of about 30 symptoms. I've got an ongoing cough still and shortness of breath. I have a lot of cardiac symptoms, so my heart rate gets really incredibly high. They found some inflammation on a cardiac MRI I had a few months ago. Hard time regulating my body temperature. I'm always cold, but I also can't handle being hot either. It sends my heart rate up really high.
Wow.
Chest pain, sometimes even feeling like I'm having a heart attack. It's numbness and tingling, all kinds of things.
So Dr. Gluckman, then how do you handle these symptoms that she's talking about? Like, how do you help them, help her?
I think it's a challenge. I think the reality is that we have individuals like Annette. We are seeing more and more as individuals have recovered from COVID-19, but have persistence, the acute illness of COVID-19, but have persistence of symptoms. And I, as a cardiologist, will see individuals with fatigue, lightheadedness, a sense that their heart isn't beating normally, and other symptoms. And I think it's a challenge for us to sort out, are these symptoms related to COVID-19? If they are, what are the underlying consequences? How long will this last for? And it's challenging because we don't have many answers these days right now.
Do you work as a team, you know, like a lot of cancer patients have a team of doctors to address different issues? Is that how now you're addressing long haulers?
We're seeing multiple health systems begin to engage multiple different types of clinician types. So these could be physical medicine and rehabilitation specialists, neurologists, cardiologists, all being quarterbacked by an individual's primary care provider or clinician.
Have you found, Annette, like other long haulers that you can connect with and communicate with and share?
Absolutely. They have been my lifesaver. I belong to a support group called Body Politic, and it's an international group of fellow long haulers like myself, and we share research, we share stories, we share ideas, and they are just fantastic, including a group of us here in Oregon that meet regularly.
Oh, that's great. Dr. Gluckman, does that kind of sharing help out? Does that help you in any way?
So this is one of the really phenomenally interesting things is we are learning more from our patients than actually the science is able to keep up.
Oh, yeah.
So this is really, at least unlike anything I've seen in my career. And so I think the challenge in cardiovascular medicine is we're used to very large trials that help inform best practices. We're learning as we go. So it's these types of support groups that provide a lot of information back to us as we accrue scientific evidence as well.
All right, give me advice to our viewers who may be dealing with long haulers.
Yeah, so I think the one thing is to recognize that a fair number of individuals will have persistent symptoms. Number two is to bring any concerning symptoms, uncertain symptoms to your clinicians, your primary care providers' attention. If you're having fatigue, lightheadedness, shortness of breath, chest discomfort, there may be an underlying cardiac cause for this, as we know that there can be acute and lingering cardiovascular manifestations of the disease.
All right, and Annette, any last words to our viewers?
I think it's just one of those things I want to say, we are not at the finish line with this yet.
Yeah.
So continue to do all the things to protect yourself, because this can really flip your life upside down.
Absolutely. Thank you both so much. I want to tell our viewers, if you would like to find out more, you can contact Providence Heart Institute. We'll put all the information on our website at KATU.com. Annette, thank you so much. And Dr. Gluckman, thank you.
Thank you.
Thanks.
We'll be right back with more AM Northwest. Don't go away.